Why do pulse oximeter readings often cause confusion? These devices show two main numbers, SpO2 and PR BPM, and understanding these can be crucial, especially if you have respiratory issues. SpO2 estimates how much oxygen your blood is carrying as a percentage. PR BPM indicates your pulse rate, showing how many times your heart beats per minute. For most healthy adults at sea level, a normal SpO2 ranges from 95% to 100%, while the pulse rate typically falls between 60 to 100 BPM. But remember, these devices provide estimates, not precise diagnoses. If your readings are consistently low or you experience severe symptoms like chest pain or confusion, it's vital to seek medical advice. This video will guide you through interpreting these readings and knowing when it's time to consult a professional. So what exactly are SpO2 and PR BPM? SpO2, or peripheral oxygen saturation, gives you a percentage of how much oxygen your blood is carrying compared to its full capacity. It's an estimate, not a direct measurement, but it helps indicate how well oxygen is being distributed throughout your body. PR BPM stands for pulse rate in beats per minute and functions like your heart rate. It's based on changes in blood flow detected by the device. Together, these readings help create a picture of your respiratory and cardiovascular health. Low SpO2 can suggest you're not getting enough oxygen, which is medically termed hypoxemia. By checking PR BPM, you can see how hard your heart is working. Remember, these numbers help provide context, but should not replace medical advice. Now, how do you interpret these readings practically? A low SpO2 with a high pulse rate often indicates that your heart is working harder to supply oxygen, which might suggest a respiratory issue. In contrast, a normal SpO2 with an elevated pulse rate can occur due to anxiety, fever, or recent physical activity. If both numbers are abnormally low, it's essential to consider environmental factors like altitude or mechanical issues with the device. When interpreting these signals, consistency and context are key. Fluctuations can occur due to natural variations, so taking multiple readings and comparing them to your usual levels is advisable. If unusual patterns persist, it's important to reach out to a healthcare provider for further evaluation. So what should you do with your pulse oximeter readings? First, ensure you're using the device correctly. Rest before checking. Warm your hands and position the device properly on your index or middle finger. Avoid cold hands and nail polish, which can skew results. If your SpO2 drops below 90% consistently, or if you experience severe symptoms like breathlessness or chest pain, seek medical attention immediately. Devices can sometimes give false readings due to user error or device limitations, so look at trends rather than single numbers. And remember, this information serves as general education, not as a replacement for professional medical advice. Always consult your healthcare provider for tailored guidance. Don't hesitate to subscribe for more insights on managing your respiratory health.